Hello, I'm Harvey Godwin Jr., Chairman of the Lumbee Tribe. And I'm sitting on the porch of the house of Henry Berry Lowry. And there's a reason for that. I want to talk to you a little bit today about coronavirus and the effects it's having on our people, and not just our people, but all of humanity. I'm here at the Henry Berry Lowry house because during our times of struggle or times of great fights, we've always gone back to our strongholds. Our kinship has always gone back to our strongholds. And the Henry Berry house is an example of that. It's our stronghold. But there are other strongholds now. Your own families, your own homes are your strongholds now. We have to contain this virus, and we have to listen to what everyone is telling us about it. All the information has been delivered almost hourly now. We have to pay attention to. And we know we have to quarantine, and we know we have to stay away from large crowds, and we know that we have to exercise the healthiest ways that we can possible at this time. So your stronghold is at your own home. At the tribe, just this past week, a decision was made on March 14th to shut down the tribe. All our employees are working from home, and they're teleworking. The decision to close was made because everything that we were hearing from the President of the United States, but more importantly, what we were hearing from our own Governor, Roy Cooper, we knew that this was going to affect our people. And more importantly, having the enrollment office open, which is the first thing we did, was close that office because we had people coming from all over the country, and without safety, for the safety of our own people and our staffs, we decided to shut down enrollment. Now it's extended to all our programs. Our Boys and Girls Clubs are shut down, and our office. But if you have needs and you need services, you can call the tribe or you can email, and our staff is at home or wherever they're working from to be able to help you. The Lumbee Tribe developed the Lumbee Tribe Disaster Recovery Service Program after our hurricanes. This is not our first fight, and this is not our first stronghold. We've been through 2 hurricanes through this administration, and now we're fighting something that is different than the hurricane. With the hurricane, at least we could console each other, and we could be in mass groupings, and we could hug each other, and we could pray with each other, and we could go to our churches and pray for the well-being of our people and all humanity, but you can't do that now. It's totally different. So with that, we are offering rental and mortgage assistance programs through the tribe starting March 23rd. If you have financial hardships, you can call the tribe or email the tribe. Someone will speak to you about this, and we'll try to help with rental and mortgage assistance. All these programs have been transcribed now and transformed, and we're finding new ways to do business with the Nahasta funds and the other programs that we have to help our people. Because this is a time that's not going to end tomorrow. It's not going to end next month. It's going to be a while. So we were developing programs with the programs we already have, finding ways to help our people in a more diverse way. This past week on CNN, Sean Penn was on camera, and he shouted out the Lumbee Tribe that he was collaborating with the tribe and bringing in supplies for our elders. We've been working on this for 2 weeks, and actually we've been working with CORE and have been collaborating with home rehabilitations. We're going to do about 35 of those with CORE, and we've been working on those, and that's in process right now. So working with, even though we're not fully federally recognized, we have collaborations where people can help us help our people, and that's what we're doing right now. The supplies that we'll get in, they will go out to our tribal elders who are living in tribal housing. Then we'll go out, reach out to the elders groups, the 15 elders groups that we have, and then beyond that. We don't know how many supplies we're going to get and how far we can go, but we're working on this right now to affect as many of our elders as we can. And as far as it goes with elders, I've heard some disturbing reports, as you probably have, where elders can't get in stores, they can't compete for as competitive as it is to try to get an item off a grocery shelf. So I would urge anyone that has elders or you know an elder, don't come in close contact with them, but if you could get some by the phone or some kind of way what their needs are and go shop for them and bring it back to them, that would be a helpful way. And we're going to be working on a volunteer program on this as we go forward. This past week I was included with other tribes across America on a teleconferencing call with the White House, and this was Indian Country COVID-19 response team. And this was discussion amongst the tribes, telling the White House what the tribes need during this time of not a disaster yet, but emergency that funding that's necessary to keep our people safe and to help our people that may become ill. We just found out this morning that $80 million has been granted just last night, and $40 million will be for new non-competitive funding that our tribe can apply for. So as we speak, we're putting together a team with Ms. Tammy Maynard and some others of how we can organize a committee to go after these grants, and we're working on that right now. And when we receive this grant money, we'll be able to help our people in a mighty way. This week, we'll set up a Lumbee Tribe COVID-19 hotline. We'll have a number that we'll post that you can call, and someone will call you and will talk to you and talk about any concerns that you have, medical concerns, and we won't be able to help you medically, but we'll be able to point you in the right direction of where you can receive help. So that should be in place this week, and we'll inform you and give you the number when that happens. The Center for Disease Control has a website. Please pay attention to it. Look at it daily. Pay attention to it and look at it daily, because things change hourly sometimes during this medical event that we're going through. It started out by telling us to wash our hands with soap for 20 seconds. Now, a lot of things that I could tell you about that, you already know. Washing your hands, stand 6 feet away from people who are sick. Ask yourself the questions: do I have a fever? Do I have a serious cough? Do I need to go have that checked out? And you know, now the process is, if you go to your medical facility, they'll ask you these protocol questions. Do you have this fever? Do you have a cough? And then you'll probably get the flu test, and if you test negative or positive for that, then you can take the coronavirus test. On a personal note, I have to tell you that I did take the coronavirus test myself. As you've seen on Facebook, I've traveled to Washington, D.C. and different parts of state and local government, federal government for many months now, working for federal recognition. So when this became about, I said to myself that maybe I've been exposed in Washington. Maybe I need to go get myself checked. So my wife and I kind of self-quarantined ourselves. And then on March the 12th, I started getting a few symptoms where I felt a little bit feverish and had a cough. So I went to my physician, Dr. Shameen Brooks Locklear, and I went through the protocol. I took the flu test and tested negative, and the next day, on March the 13th, I took the C test, and it took 4 days up. It took until March 18th, I got my results. So I was quarantined at home with my wife, isolated even from her in a separate part of the house where we weren't even around each other, and waiting for my test result. When my test result came back for C test on March 18th, and it was negative. But those were grueling times, because I was thinking back during those times on teleconference with the tribe and other people that I deal with on a daily basis, and thinking about all the people I came in contact. And let me tell you, it was literally hundreds and hundreds of people that I could identify on paper who I had been in contact with. So this is why it's so critical that we got to keep this social distancing. If one person gets it and you're in a crowd of people, they're all going to get it. They're all going to get it. And our elders are the most susceptible, and our people with health problems most susceptible, especially diabetes and health issues like that. If you get coronavirus on top of those kinds of issues, it's going to be a very life-threatening situation. And that brings me down to talk to you a little bit about the churches. Our pastors are out there, and our deacons, and you're managing churches and flocks of people. And it's important that we understand that we put God first in our lives. And this is the fight that we're in. We fought through many battles as a people, but now this is different. This is different. This is a illness that affects everybody. It's not just an Indian illness. It's just not African American or Caucasian or Asian. It's an illness that affects everybody. And if you have a church on Sunday morning and you have people sitting in your congregation, and if just one person is sick, it's going to make everybody in that church sick. And then you're going to take it home to others. And young people, watch where you go. Pay attention to what they're saying on television. If you become ill and you're healthy, yes, you can fight through it. But if you take it back to your stronghold, to your families, you're going to make your grandmother sick or your grandfather sick or your parents or someone that may have an illness in your family, and then they all get sick. We got to be so cognizant of what we're doing now. But we can still pray. Churches, you can have video your sermon that a minister would want to present to the people at any time and put it on Facebook or any way you want to teleconference it back to your flocks and let them hear the message. But we can all still pray. Our strongholds can be praying. Our strongholds being our families now, praying for our future and praying for all of humanity. Because our Lumbee people are everywhere, but we're involved and we're engaged with people from all over this country and all over the world, our service people, everyone. If a service person comes home and they come home to their stronghold of their family and they get sick and they take it back, then they make our military sick. So there's so many things to think about, and I just want to say that we're going to get through this. We're the Lumbee people. We have Lumbee people who are medical professionals. God bless my medical professional who assisted me during my time of going through the process. We have Lumbees who are administrators, who are entrepreneurs, and that's one thing. Small businesses that are owned and operated by Lumbees. This affects your workforce. It affects the way you're going to make a payroll, and we will give you more information this coming days. These videos right now will be more frequent, and there's money for SBA. There's money out there for FEMA that you might qualify for as a small business. But we will get this information out to you, in frequent information. As soon as we get it, we will post it on our Facebook page, and we'll have more videos like this of messaging. Pay attention to CDC and what their messaging is saying daily, and exercising what they're telling us to do with our families and our strongholds. We're going to get through this, and we're going to get through it together, and we're going to be successful just like we always have on the other end of it. But right now is a very critical time. So protect your strongholds, keep praying, and may God bless you, the Lumbee Tribe, all of the Lumbee Tribe, and everybody in America and across this world. We're all in this together. This is a global pandemic. And the more we do to protect ourselves, the more we can help all humanity. Thank you.